Good morning, everybody. It's Dr. Petteruti here at Intellectual Medicine and WPRO. We are so happy to be here, me and Tyler, bringing you the top of the morning with exciting news from the world of medicine. Today, we're going to be talking about the advances in cancer testing. A new test called the IvyGene test can now pick up DNA fragments in the blood that can reveal the presence of certain forms of cancer. We're going to be talking about that test, who should get it, what to do with it, and its limitations. As always, we're going to be bringing you the advances in medicine. But before we do that, we have to reflect upon the essence of our existence. What is intellectual medicine? Why is it here? And how did I get here? And why are there orthodox, old school doctors lining up against our freedom to speak and our freedom to share is to know that you can help people and fail to act. Possessing knowledge that can help people and failing to act is an ethical lapse of itself. And if you fail to act out of fear of self-repercussion, you've doubled down on your self-interest and you've doubled down on your, lack of courage. So there we are in our orthodox medical world, making good money. I mean, medicine is pretty remunerative. You get paid okay. And every day I'm seeing my 30, 40 patients, like many of my colleagues are still today, practicing my best form of orthodox medicine. But something happened. It was about 10 or 12 years ago I started a study. Fatigue, brain fog, who was not happy, who was not technically diseased but just not well. Or conversely, patients battling cancer, suffering with the atrophy, the withering, and the misery of it. And our research has led us to a place where we now have this outlet called intellectual medicine. Years ago, I started this radio show, and one of the first things I talked about was the exciting developments and the possibilities of high-dose vitamin C as regards to helping support the fight against cancer. Now listen carefully. This is the field that launched one of the complaints that have been registered against intellectual medicine, and me in particular. These complaints have something in common. They all come from gray beards of the old guard. One, a former Department of Health administrator. Another, a former medical director of a major health insurance company in Rhode Island. 3, a former head of a hospital. What do they have in common? We've never spoken to one another. We've never managed patients together. They have never bothered to study what I do, nor ask me about the opinions I render. They are all on a first-name basis with administrators at the Department of Health. They all have special access to those administrators. And they all have, well, to one degree or another, called me a quack and a charlatan, and have portrayed what we discuss at intellectual medicine as fraudulent. That, ladies and gentlemen, is the landscape that we face. We knew that there'd be some opposition as we entered the field, but as I mentioned, we moved forward anyhow. And why? And in a nutshell, it's because you realize at some point in your journey through life that you're going to die, and that upon your death, everything else becomes relatively diminutive in relevance. Is the purpose of going into medicine simply so you can churn patients, get a paycheck, and then retire and go to Florida? And the whole while trying to avoid controversy? Doctors are being beaten into submission. Freedom of thought is being beaten into submission. The latitude to practice is being stripped away. The doctors who go the extra mile for their patients are more likely to face a negative consequence than an accolade. And intellectual medicine has borne an aspect of all of these. Now, over the weeks to come, we'll be sharing you this ongoing story. We think it is important that it have a public airing. Administrative committees like to do things in silence. They like to do things in the back room. They have unlimited financial and legal resources. They crush doctors oftentimes not because of the legitimacy of their position, but because of their ability to win a war of attrition. So we cancel our vacations, we put more money into our legal defense fund, and we skinny down our personal lives so we can continue to do what we believe in on the part of our patients. Now, the information I'm going to share with you today just puts an asterisk next to the importance of this. It's not enough to tell somebody facing the edge of dementia, somebody fighting cancer, somebody fighting chronic atrophy, somebody whose vitality is stripped away. It's not enough to tell them, well, there's good research in that field, when in fact there are interventions available right now. We have them at Intellectual Medicine. We will not stop providing them until they put a padlock on the door. We believe in our patients' right to have this freedom of choice. Even if you disagree with some of what I say, we believe in the intellectual, respectful, and tempered approach of conversing and reflecting through differing opinions. I attempted to reach out to all of my critics and invited them to have a conversation with me. Not one responded affirmatively. They would rather hide behind administrative processes. Well, this is an ongoing story. This is kind of fun because normally these things happen in private, but you know me, I got to talk about it. In the meantime, though, how about a blood test that can reveal cancer? How about if you've ever had breast or colon cancer and you're wondering, is it back? And you're wondering, is there anything else that can be done besides waiting, tick, 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 to see when a tumor pops up? Well, I've got exciting news when we come back after our break and what to do about it. This is Intellectual Medicine. I'm Dr. Steve Petteruti.
News Talk 630 and 99.7 FM, WPRO, along with WPRI 12, Eyewitness News presents...
We got to give our New England Patriots prediction, too, before the close.
As Tim Whitehouse
Yeah.
interviews with Southern New England's top politicians and other
So the battle goes on, and it's been engaged. And the Department of Health is trying to aggressively interfere with our ability to practice medicine. They don't like what we do. They don't like what we say. They don't like how we say it. They don't like our website. They don't like our radio show. They just don't like anything about what we do or how we do it. They think I'm a quack. They think what we do is charlatanistic. They think it is fraudulent. They don't think it has any validity in science. They're wrong at every point. But it's been said in medicine, the way to convince your opponents that they're wrong and you're right is to wait for them to die. Well, that's kind of a long wait. Probably not as long as it may seem in regards to some of these guys. But, yeah. That's right. Tyler complaining about the New England Patriots Detroit Lions. It is going to be a yawn fest. Yeah, one of the worst teams in the league. But no, I really I appreciate that you all are interested in what we have to say. I appreciate that you all are engaged, that you all are going to the internet and researching your own information. We respect the knowledge base of our patients and the ability for them to discern what's best for them. That's an important detail. What's best for an individual patient should not be constrained by bureaucratic edict. It should be the latitude of a doctor-patient to decide. In the absence of extreme harm or reckless endangerment, none of which occurs, they should be able to pursue the path that they want. I mean, what's wrong with living better? Like, why does that upset people? What's wrong with pursuing a 120-year lifespan? Why is that not legitimate? What's wrong with seeking means of diminishing the risks of cancer relapsing? What's wrong with going beyond the boundary of FDA-approved therapy? Is medicine come to this? That the only thing that can ever be recommended or prescribed is that which has been FDA approved? The cabal of orthodox medicine, the unholy alliance between pharmaceutical companies, now they're not all intrinsically evil, but they use their position of power to suppress competition. Make no mistake about it, folks. Intellectual medicine and the rising tide of compounding pharmacies willing to creatively work with doctors with advanced knowledge like me and Dr. Souza, we're a threat. There's something like 20% of prescriptions are now coming out of compounding pharmacies. That's not going unnoticed. I recently did a search of compounding pharmacies in the FDA database. Every one of them, every pharmacy, is under some degree of scrutiny by the federal government. Now, that is not all inappropriate. We all remember the horrors of New England compounding and the way that those hacks killed people because of their sloppy practice. But, like usual in America, the pendulum goes too hard the other direction. Anyhow, we'll be here until you see a test pattern. We'll be here until they drop a nuke on us. We'll be here because we believe in what we do and who we do it for. And we don't do it for the approval of other doctors, our colleagues, or the Department of Health. Hey, Ty, what's up? Oh, okay. Okay.
Now, back to Intellectual Medicine with Dr. Petteruti. Call in now at 438-WPRO or 1-800-321-WPRO.
We are back, everybody. I'm Dr. Steve Petteruti. This is Intellectual Medicine on WPRO, your intellectual voice of Southern New England. So we were talking about the the attempts by the Department of Health and the complainants against intellectual medicine to stymie what we do, to prevent it from happening, their desire to see this put to an end. One of the complaints about us is that what we do might be dangerous. Folks, we just underwent a 42-page white glove inspection from the Department of Pharmacy. Our drip bar is one of, if not the most advanced, most technically astute in the nation. We're the first drip bar in the country, to our knowledge, to go through such an extraordinary degree of scrutiny. And I give great credit to my staff, to Tammy, to Shannon, to the whole team. The place was sparkling. The few minor issues were immediately corrected, and we have a clean record from the Department of Pharmacy. 42 pages worth. 10,000 drips and counting, no major complications, 0 infections. We're really proud of that record. We think it's critical. It's one thing to do things that are a little bit off the radar screen, but if you're going to do that, you've got to be on top of your game, and we are. And why? I'll tell you why. Because we knew patients would come to us that had serious medical illnesses, cancer, Crohn's disease, chronic Lyme disease. The beat goes on. These patients deserve and need a reliable place where they can get A, clear information delivered in a balanced manner, and B, options for treatment rather than just sitting around and waiting to wither. So here comes IvyGene. Now, this company, write this down, IvyGene. You can Google them. Their website's fantastic. It'll link you to research papers and information about what they do. They have developed a method of blood testing for DNA markers of cancer. It turns out that that DNA can be methylated. That is, the DNA can be temporarily modified based on environmental factors. And the DNA gets modified in a specific pattern. It's a bit of a fingerprint, if you will. And the DNA is modified in normal cells in a very distinct manner. And in cancer cells, that DNA gets modified in an alternative and discernibly different manner. That DNA, that methylation process, is potentially reversible. It's not a permanent mutation of DNA, but a temporary modification. The technical term for that is sometimes called epigenetic, a combination of gene and environment. So follow me. This epigenetic marker for cancer occurs by a unique pattern of methylation on DNA. When those cancer cells die, which they are constantly dying and dividing, they shed the DNA into the bloodstream, and that DNA can be captured, can be tested, and can be analyzed. Now, the cancers thus far that the test has been validated for include breast, colon, liver, and lung. Now, this is really valuable. These studies have not been proven in large-scale, long-term clinical trials. Those trials should be done, and we look forward to their outcome. But here is the essence, in some ways, of intellectual medicine. While we're waiting for those long-term studies to be performed, what do you do right now? Those studies may take 10 years. And yet this test is available today. It's a lab-developed test that has been allowed by the FDA. Now, I was just saying to my audience, because something is or is not approved by the FDA does not define the boundary of healthcare. An FDA-approved treatment has its unique distinction and its merit, but the absence of such approval does not invalidate the worthiness of a treatment pathway or a modality. It is, in fact, essential to pursue higher grades of health, in our opinion, to look at things well beyond those boundaries, because the FDA is reacting to disease, not modifying or intervening with health. So how might this test be used? Can it be used as a screening test? We don't know. One of the problems with it is that these methylation markers, they're very good with correlating to the cancers I described, but they're not 100%. In other words, you could have a positive test but not have cancer. You could have a positive test and have a different form of cancer other than the one described. Well, what about standard screening? Here's a problem with standard screening. In most cases, to see a tumor 1 centimeter in size requires approximately 30 doubling times of those cancer cells. So let's imagine that a cancer takes 3 months to double, and you start out with 10,000 of them, and in 3 months you've got 20,000, etc. It could take years for cancer to manifest as tumors that are visible. Years. We believe that this is one of the reasons why there is such a problem with delayed metastatic disease in the face of things like breast cancer. From a study recently published in a major medical journal, they outline this risk. It's a real dilemma, because what do you do if you've had cancer? Let's say it's colon cancer, let's say it's stage 2, stage 3, and you're declared cancer-free. Well, let's rephrase that. You're tumor-free. They can't see any cancer on the CAT scan. It does not mean it's not there. There can still be stem cells, there can still be cellular cancer, circulating cancer cells in your blood that are waiting to develop. What are you going to do about that? So suppose one of these tests comes back positive. Well, there are things that are known to be adverse to the healthy environment for cancer to grow in. We call this secondary prevention, meaning that you've had the disease and now you're trying to prevent it. So I see this as a major opportunity for those with prior cancers that are now in remission. They're out of their treatment pathways, they're no longer in chemo, radiation, etc. But there's a fear of relapse. Periodic measuring of the IvyGene blood test has the possibility of being an early warning system. Even if there are no tumors present, that early warning system can help stimulate lifestyle change. We know that excess adiposity, obesity, correlates with increased cancer risk and relapse in many studies. We know that there are certain use of supplements that have been purported to have merit. And we are intrigued. Now here comes the part, folks, that got us in hot water to begin with, but we must repeat this. We must repeat this science because the possibilities are oh so compelling. The possibility of doing high-dose intravenous vitamin C on a regular intermittent basis in the absence of visible cancer, but in the presence of high risk, might that afford an opportunity to kill cancer cells or be toxic toward them at a point where they are most vulnerable? That is, when they are not aggregated into tumors, but are still circulating in the bloodstream. What I just said has been the genesis of one of the complaints against me. It is also compelling science with a valid core. Multiple studies have demonstrated cancer's toxic effect on a wide range of cancers. Vitamin C's toxic effect on a wide range of cancers. We don't know whether or not what I just outlined will have any impact on relapse rates. We just don't know. And the study necessary to validate whether or not intermittent use of intravenous vitamin C can prevent relapse of cancer may never be done. Number one, because every time doctors talk about it, they get shot in the head. Number two, because those studies are extraordinarily expensive and will require decades of follow-up. However, does that mean we ought not to consider it? The risk is minimal. The price is nominal. The frequency required, in our center, we advocate for this being done at approximately 1 month to 2 month intervals, depending on the cancer and its aggressiveness. We believe that this is a worthy consideration if done with clear head and good counseled advice. The possibility that doing this on a regular basis can diminish the risk of cancer relapse is intriguing. Now, suppose you get this test done by IvyGene and it comes back positive. Imagine you've had breast cancer 5 years ago, and the test comes back positive for remnants of cancer cells. You go to your doctor, you get a mammogram, it's normal. You get a CAT scan, it's normal. What do? This is a niche where vitamin C, we believe, can afford some possible merit. That is one of the reasons why orthodox medicine has not rushed to embrace this test. What do you do with the result when you don't have a remedy in the face of an abnormal test? If the IvyGene test comes back abnormal, it's not a basis for putting people back through the toxicity of chemotherapy, nor surgery, nor biopsies. It is a real conundrum. And here is where intellectual medicine intersects with orthodox medicine. The thoughtful application of these interventions to try to help keep people well. We got to keep talking about this, but before that, from the Revolution Softwash News Center, it's Doug Lizette with today's headlines. Hey, Doug, what's happening?
Hi, good morning, Doctor.
This is a deep topic, folks. I hope I'm not losing you, and I know I'm not, because you guys are super bright. That's why you're tuning in and listening. But think about it. It's just logic. If cancer is developing on a cellular level, it's logical that at that point it's more vulnerable than if it's coalesced into a huge tumor. That's the essence of early intervention. Now, if you've ever had any form of cancer, where's the risk of doing vitamin C intravenously? Time and money. That's it. The treatment itself is benign. It's about a 45-minute IV infusion done in the comfort of our exquisitely pristine and sterile environment, where over 10,000 infusions have been delivered with no infections. That has been inspected by the Rhode Island Department of Pharmacy, the first in the nation with such scrutiny and distinction. And why wouldn't you do this? Well, if you don't believe in its merit, don't do it. If the time and the money factor is stressful, don't do it. But sign me up. Sign Shannon up. As regular listeners know, she's had melanoma twice. Superficial. But here's the creepy part of cancers like melanoma. When it comes back, it doesn't give fair warning. It just sweeps you away with diffuse metastatic disease. Somewhere between I feel great and I'm dying of cancer is a dark zone that we need to fill in with something better than what we got. We believe vitamin C can be part of that gap. in addition to other aspects of healthy living. Interesting stuff we'll talk about too about, I don't know if I have time, we got to get to it. We'll just keep talking, like I say, until the lights go out. But the study on aspirin, looking like it's not such a beneficial intervention. And a study looked at estrogen deprivation in women, found a 42% increase in chronic kidney disease in women who had their ovaries removed, and even higher in those who had them removed at a younger age. It appears that estrogen deprivation, and this is a quote from the study from the Clinical Journal of the American Society of Nephrology, estrogen deprivation may have important direct harmful effects on kidney structure and function. Mark another one in favor of replacing your hormones, folks. As we've said all along, you're either going to replace your hormones or suffer the consequence, and here's another in the growing list of negative consequence of hormone deprivation. Have little information about dementia rates, pain. I'm going to tie this in. We're going to talk about transplants and cancer. So you can call Tyler at 1-800-321-9776 if you want to funnel a question to me. I know normally we like to do it right through the Facebook page. By the way, share this information. Our only remedy to the consequences in front of the Department of Health is going to be information they receive from other expert colleagues and from the public at large. The Department of Health acts to defend the public interest. If the public interest is being threatened through charlatans, through misguided or misrepresented information, they have a duty to act. We believe that they have acted with bad information and in a manner that ironically ends up hurting the public because it deprives them of broader information about their health and the options they have to address it. And we're asking for your support as we go through this battle. And we'll share with you over time, different elements of it. We are still in the midst of this battle. We don't know how long it'll last, but we predict it to be long, expensive, and stressful. But, we've got thick skin and a full commitment to it. As I said on the show earlier, at the end of the rainbow, we all punch out. Looking back at my life, I'm not going to say that my knees buckled when they got hot in the kitchen. I'm not going to say that I quit believing in what I believe in out of fear of personal consequence. It's the definition of cowardice. So we march on. Either that or I'll just quit everything and just go to a walk-in center somewhere in Idaho. Just pile money into my retirement account and go to Florida and die playing shuffleboard. Somehow I don't see that in my DNA, folks. And I don't know that there's a test for that in methylation markers either. And I don't see it in your DNA either. People tuning this in are taking charge of their health. And there are some in the Orthodox channels that hate that. They hate the idea of an informed patient coming armed with their own thoughts and ideas. They don't like having to debate information that they themselves don't possess. One of the complainants against us actually said, "I've never heard about this, therefore it must be bad." That's a paraphrase. That's a tough standard, isn't it? The knowledge I have is legitimate. Anything outside of my fund of knowledge is by definition dangerous and illegitimate. That's pretty self-serving. All right. Cancer transplants. So here it is, my prediction for New England. The game's going to be super boring. New England will win. Josh Groden will be a non-factor. Now, he's the new receiver they received, right? Unless he can play right tackle on the offensive line, I don't think it's going to make a big difference. As long as Tom Brady is throwing the ball off of his back foot while he's getting crushed by the D-line, it's not going to make a difference. When you get against the better teams like Jacksonville, they all have a very good front seven that are going to put heat on the quarterback. And if we don't have Marcus Cannon healthy at right tackle, okay. Go ahead and screen the question.
You got it. I didn't have time to yet, but I will once we're back now.
All right, and I'll read it.
Medicine with Dr. Petteruti. Call in now at 438-WPRO.
I'll give you the thumbs up when I've got it.
321-WPRO.
Hey everybody, it's Dr. Petteruti. We are back. This is Intellectual Medicine on the Voice of Southern New England, WPRO. Shannon is not here today. She's filling in for my drip bar nurse who's on vacation. Now, Shannon is really a do-it-all person. She can run the drip bar. She is astute in her knowledge of anti-aging and hormonal therapies. She's a nurse practitioner with full prescribing abilities. And she is running the website and is the heart and soul of the growth of intellectual medicine. That's right, the growth. You know, we're growing by leaps and bounds, and that really annoys a lot of the orthodox medicine doctors. You know, if we were just a quiet failure, nobody would care. So I was talking to my son. He's been on the radio show before, and I was sharing with him some of the challenges we have. That's great, Dad. He goes, you know what? If people weren't complaining about you, it's because you'd be irrelevant. Was it Mark Twain who said the only thing worse than people talking about you is, well, people not talking about you? But we were just talking about cancer and the cellular manifestations, circulating cancer cells. Here's a piece of information that relates to this in a clinically relevant way. Recently, a 53-year-old donor for organs, a 53-year-old died due to a stroke and donated organs to 4 patients. Years later, all 4 patients acquired cancer. When they went back and looked at the DNA of the cancer, it all came from this one donor. Now, before anybody donates their organs for transplant, they go through a rigorous screening. This patient went through that screening, mammogram, total body imaging, blood testing. They're searching for cancer or for any transmittable disease. Now, the donor passed all those tests. Nevertheless, years later, breast cancer cells were found in the transplant recipients. This was due to what the authors felt were, quote, micrometastases, end quote. Basically, clusters of cancer cells that cannot be detected that float through the body and attack the host years later. Remember, I was just talking about doubling time, that it can take months for cancer cells to double. The rate of doubling varies depending on the host. That is, if you're healthy, your immune system's working great, it's possible that can reduce the doubling rate or how quickly the cancer grows. According to one of the authors, Dr. Bemelin from the University of Amsterdam, he said, quote, immune system can restore itself when we stop these drugs, the immunosuppressive drugs used for transplant patients, and fight against the cancer. So herein lies some clinical evidence supporting this idea that microscopic metastases are relevant, that they can go undetected by conventional screening studies, that they can rear up years later to demonstrate the presence of tumors. Now, I have very deep interest in this and a passionate desire to see us do things to prevent cancer relapse more than just waiting and doing CAT scans. You know, Shannon has had melanoma twice. The problem with diseases like melanoma, it can go from being stage 1 to terminal without any forewarning in between. That's the dark zone, the quiet zone between the stage 1 diagnosis and, oh my God, there are tumors everywhere. What happened? What happened in between? We believe it's this propagation of micrometastases. Now, wouldn't it be interesting if we could do these blood tests from IvyGene every year on patients that have ever had cancer and track those results? Well, at Intellectual Medicine, we are endeavoring to gather just this data. We are in the infancy of doing this. Patients that have signed up with Dr. Souza in East Bay or with me in West Bay that are choosing, after informed consent, to weigh the risk versus benefit of our non-FDA approved and unproven in long-term studies. There, did I say enough to disclaim it? But nevertheless are intrigued by the possibility of high-dose vitamin C suppressing the propagation of microscopic cellular levels of cancer and diminishing the relapse risk. We are now starting to track them and watch it. And if we are allowed to continue practicing, we believe that in the years to come, we will have enough data to start to make sense out of this theory. Now, what's the hazard to somebody engaging? The two things are going to be time and money. right? You got to pay for the treatment and you got to show up. It's about $180 every month if you're doing a monthly treatment. We are endeavoring to make this available. We want it to be near every patient. We are striving to spread intellectual medicine and the availability of these approaches to other doctors, to other places throughout the country. You should not have to hop in a plane and fly across a nation to get this. And because cancer, in many cases, is a chronic disease state, as opposed to an episodic flare, it requires ongoing monitoring and support. And the orthodox approach is fantastic. They've made some great strides, but it's simply incomplete. So I'd invite you to offer your thoughts and comments. You can do that through our Facebook page. We do read and respond whenever we can to thoughtful comments. We invite you to listen to this radio show and to offer your thoughts and comments. Tyler's always there to take your calls, and you can even share with them the questions that you may have, and we can read them on the air and reflect back on them. But I got a couple minutes here, but this is super exciting regarding hormones. I'm going to shift gears a little bit. A study from the clinical journal in the American Society of Nephrology has found that women who've had their ovaries removed had a 42% increase in chronic kidney disease. That's right. It turns out, according to the study, that, and I quote, estrogen deprivation may have important, direct, harmful effects on kidney structure and function. Interpreted, the absence of estrogen can lead to kidney damage based on this study. That's compelling. I've told you before, you have two choices in life: replace your hormones or suffer the consequence. And here's another one. Well, who else is lacking estrogen? Every woman going through their perimenopause, that's who. And as they age, that deprivation increases. It's possible, if this correlation holds true and the study was well done, it's possible that replacing estrogen therapy at a young age and keeping it at good levels will protect your kidneys based on this study. So why not? Why not consider that approach? Put that in the category of potential benefits. Now when we come back, I'll give my prediction for the Patriots game. I said it on the Facebook page. You guys deserve to hear it as well. We'll circle back. What about aspirin? Should be taking it. There's new information on aspirin, especially if you're over the age of 70. And an interesting protest regarding pain that I'd like to alert you guys about. Claudia Morandi from the Don't Punish Pain cohort is liking us to be aware of some of the negative consequences of constraint of prescribing pain medicines. I'm Dr. Steve Petteruti. This is Intellectual Medicine. We'll talk to you in a few minutes.
Before you go, two things. There was one call, it sounded very complex. I did type it in the screen. Jim said a 61-year-old woman, I'm guessing his wife, had lung cancer. They went in for surgery, and when they did, they in each lung found some cancer, but it was two different types of cancers. They want to know if you have any recommendations, since two different types of cancers were discovered in the lungs, and they're already doing a bunch of tests on the messenger. And you have a second call flashing. She says she's already one of your patients. Her name is Barbara.
Okay.
Do you want me to?
Oh, yeah, just see what her question is. We can decide if we want to put her on air or read it, and I'll address these other two.
Could do. So welcome to Coursera, the world's campus of online learners. To join Coursera for free and start your future today, text GLOBE to 250250. Coursera, your course to success. Text GLOBE to 250250 now.
Right now, Mobile One Full Synthetic Motor Oil is $29.99 for a 5-quart jug. Its advanced formula provides maximum sludge protection, defending your engine like a catcher defends home plate. So, get top-notch engine protection with the Mobile One Full Synthetic 5-quart jug for $29.99. Quality parts, helpful people. That's Napa know-how. Napa know-how. General States pricing. Sales prices do not include local state local taxes or recycling fees. Offer ends 9/30/18.
When working at a growing business, you wear many hats. The new business hat, the buying toner for the copy machine hat, the sifting through tons of resumes hat. You could throw away that last hat thanks to Indeed.com.
Hey guys, sorry I didn't mean to ignore you. I was just talking to Tyler off air. A couple of interesting questions came up. Yeah.
So she said she wanted
You know, I'm not familiar with it, but I'll research it and comment about it at another time.
I shave my head, comb it over, wear a hat.
Yeah, that's kind of what I answered that because I knew that probably wouldn't be, well, I know your radio style and I know what makes good radio too.
You're a smart guy, Tyler. You're a smart guy. He knows what makes good radio. So, yeah, we appreciate your comments and recommendations. When they come in, we like to first research them before we share them on air so we can find out the substance behind them. So if you have a thought or have come upon information that you think has value and you'd like to broadcast it to a wider audience, we welcome that information to be funneled to us so that we can do our own research and decide if this is the right platform for expanding that awareness. So that was just because somebody called and asked about a website and wanted our thoughts on it. So we respect your research. I like to say I have 1,000 research assistants because people are out there researching things all the time and sending me information, and I value it and I read everything. It may take me a little while to get back to you on that, but it's what I do. It's my hobby. I love it. It's fun. I love learning new information, especially when I can take that information and we can apply it to our patients right away. Anyhow, IvyGene, IvyGene, the cancer test is available today at Intellectual Medicine in Warwick and at Intellectual Medicine in East Providence. It's available today.
Prepared for hurricane season. Know your risk. Acquire 10 seconds and identify evacuation routes. Visit riema.ri.gov for information. This message brought to you by the Rhode Island Emergency Management Agency and the Rhode Island Broadcast.
Hey, Tyler, what's the other patient's name?
The one who we're not taking the call of?
The second one with the post-surgical cancer.
Oh, the caller's name was Jim, but it was about a woman, so I'm assuming it's his wife.
Okay. Hey guys, we're back. It's Dr. Petteruti, and we did have a couple of really compelling calls and questions that came up while we were talking that I want to share with our listeners. And I would like to say, and Tyler does a beautiful job back there. He's working hard, keeping the show humming along. And Tyler is a really nice guy. He's easy to talk to. Call him anytime. Our style on the show is to typically have Tyler listen to your question, annotate it, and then for me to answer it so that we can keep the show moving. We would love to have the time to just put people on the air, and occasionally we do that, but in the interest of getting the most information, we find this to be productive. And I like to say that I have 1,000 research assistants. Well, really 20,000 based on the listeners of our show. Anytime you find something that you think is interesting, is valuable, is worthy of our audience to hear, we welcome it to be sent to our Facebook site, to our website, or you can call Tyler and he'll jot that information down. I like to research that information before we use this platform to disseminate it. We want to make sure that what we're talking about has a foundation in some credible science. And so we welcome that input. I do read everything I get, and I thank you all for sending it. It may take time, but we'll get to it. So this question came across from Jim, and there's a 61-year-old. His wife had 2 different forms of cancer in the lung. And the question is, what might be done to help address this? Jim, I'm sorry that your wife's fighting cancer. It's just, I hate cancer. It's an awful thing. But the fact that there are 2 different kinds of cancers, I'm going to presume there are 2 different cell types of cancer in the lung. Now, that could mean that you have 2 primary cancers happening at once. That is, 2 different cancers are being spawned concurrently. Or there can be 1 cancer in the lung and a secondary cancer coming from another organ that is metastasized or gone to the lung. Jim, this is complex, and in many cases, there's no cookbook approach for this. It requires the thoughtful input of a team of oncologists in many cases. Most of the, in fact, all that I know of the cancer treatment centers have what are known as tumor boards. And a tumor board is a gathering of experts in oncology or another field where they will, in a group, look at the case. They'll look at the cells. They'll look at the biopsies. And they'll have a robust conversation about how to approach it and recommend a treatment. Now, when you're in the realm of the rare and the unusual, it's my strong advocacy that you gather at least 2 opinions. As good as the oncologists are that you're engaged with, and there's a high level of quality amongst cancer specialists in America, high level. And you can get high quality care in many, many places, but it's fruitful to at least go to 2. And I've had some patients just resonate with one center over another. So typically when you have got multiple cancers, the treatment options tend more toward non-surgical interventions. Now, what about what we offer, intellectual medicine? Now, having said that nothing that we offer has been FDA proven to help fight cancer, intravenous vitamin C has studies that support its benefit regarding side effects from chemotherapy. Certainly one of the devastating effects of cancer is a consequence of treatment. You end up feeling tired, weak, nauseous, weight loss. A lot of times these symptoms can be helped with some of the modalities we offer at Intellectual Medicine. We call that complementary care. We don't like the term alternative care. We feel it's more complementary. Now, your oncologists are filled to the brim with their own fund of knowledge. It is hard to keep abreast of the information that funnels into them every day. They're expert at chemotherapy, at radiation therapy. It's what they do. It's not what we do, and we're not expert in that field. We respect and appreciate it, and we're knowledgeable about it. But likewise, we don't expect them to be exquisitely knowledgeable about which supplements may have value, about what vitamin infusion may have value. We reach out to and we like to communicate with our oncologic colleagues. It is our practice at Intellectual Medicine, both Dr. Souza and myself, to send your oncologist a detailed note describing what we plan to do. If we're going to use intravenous vitamin C, we want your doctor to know about it. We now have completed CME training, that's a continuing medical education training recognized by the AMA in mistletoe therapy for helping fight cancer. Depending on your cancer type and its location, mistletoe therapy, although not FDA approved, nor is it been proven in long-term studies to cure or help stop the progression of cancer, nevertheless, it is widely used throughout Europe, has multiple case studies supporting potential, possibility of merit. So for some, intravenous mistletoe becomes an option to consider. These deserve individual consultative reflection that both Dr. Souza, Shannon, and I offer through our intellectual medicine centers. Another compelling circumstance, so in summary, I don't want to make specific recommendations regarding the cancer at question without full knowledge about it, other than to say there are complementary modalities available that can improve quality of life and that have a possibility to have value. And when they're done concurrent with orthodox treatments, they seem to have their most merit. That, to me, is one of the most interesting and possibly beneficial areas for complementary cancer care. Too often, people wait and wait and wait, and by the time they come to see us, the cancer is like a house on fire, and we are their Hail Mary pass. That scenario, while we look forward to helping those patients live a better life, that scenario does not lend itself to the best possibility of outcomes. Better started earlier. Another scenario, and this was a circumstance from another caller, a second type of cancer discovered post-surgery. So I'm going to interpret this slightly differently. Sometimes you can have a primary cancer. Let's say you had kidney cancer and they take the kidney and now you are cancer-free. It's quite possible that the same environmental, lifestyle, and genetic elements that caused the first cancer to happen put you at risk to get a new secondary form of cancer. That is, not a relapse of the first one, but a brand new cancer. Now that kind of makes sense if you think about it. The same person with nothing changed about them would possibly have an increased risk of developing another cancer, which is why we're zealous advocates of secondary prevention. What things do we know that increase cancer risk? Radon has been associated with lung cancer. Radon can be tested in your home and can be mitigated. Cadmium is a class 1 carcinogen. Cadmium has been correlated with increased risk of lung cancer. and suspected to be an increased risk of other forms of cancer as well. The best way that we know of to test for cadmium is with a provocative urinary test after receiving intravenous calcium EDTA to flush the calcium out of your system. This test is done at Dr. Souza's Center in East Providence, at ours in Warwick. The cost is modest. It's about $160 to find out how much cadmium is in your system. Lead we know is a pure toxin, damaging arteries, damaging the brain, and it has been proposed as an increased carcinogen. How about lifestyle variables? What we eat, how much we eat. Foods are worthy of being scrutinized. At Intellectual Medicine, we take you through that reflection. Our naturopathic colleagues are well versed in this field. Many chiropractors possess this knowledge. It is not reasonable to expect your oncologist to have this breadth of knowledge. It is overwhelming to acquire, and as I mentioned, they're up to their eyeballs keeping up with what they have on their plate. That's why we wanted to have this as a complementary pursuit. The other thing, live at your best percentage body fat. Fat is a carcinogen. It correlates with 14 different kinds of cancer. We can help you with that at Intellectual Medicine. We have our Intellectual Medicine pathway of treatment for fat reduction, not weight reduction. Listen, if you're doing anything to reduce your weight, you must be analyzing your body makeup. If you're losing weight, you don't know if that weight is muscle, bone, or fat. And the fat is the only thing that matters with regard to your health. Well, folks, this has been a joyful time spent with you. Got just about a minute left, but I want to invite you to become a party to our movement, our desire to continue to make intellectual medicine, and more importantly, the open and honest conversation of advances in science and medicine a part of the ongoing dialogue. Discussing things like IvyGene, like IV vitamin C, like mistletoe, discussing things like the role of supplements and nutrition in your health should not be a cause of administrative adverse consequence to doctors nor their patients. We need to keep this alive. And we'll do that because you guys keep listening, keep researching, keep sending us your questions and information. Hey, we're in this together. I want to live to be 120. Sign me up for that lifestyle. Until then, we're wishing you 120 youthful years. See you next time. Well, there we go. The battle goes on, and we are fully engaged. Look, we didn't bring this fight on. We didn't invite it, but it's there. We knew it was a possibility when we started to do intellectual medicine. Both Shannon and I reflected on that. We knew that we were putting our livelihood and our material well-being at stake. And we decided we'd do that anyhow. And so here it is. Instead of going on an anniversary vacation, we will be paying legal bills and engaging in a fight. It's a good thing that we believe in what we do, and we welcome the upcoming debate, and we welcome the upcoming fact-finding and information to be shared, and we'll share it with you on a regular basis as we continue our journey together. See you all next time. Patriots.